I've chosen these particular topics because I believe actually they represent a kind of hierarchy of argument that leads ultimately to that bottom line that you see there in that fourth topic. There's a kind of unwritten subtext to all of this, which is not just the demonization of Israel in a very systematic way, but with a bottom line objective of getting rid of the state of Israel. I want to start with Palestinian health because this is something that I've had particular interest in and involvement with for a number of years, going back to the 1980s when I worked at Ben Gurion University of the Negev in Beersheba. In those days, Israeli Arabs, of which the Bedouin Arabs were a large proportion in the southern part of Israel, didn't identify themselves specifically as Palestinian, but that's a trend that has developed over recent years. So the projects I worked in when I was there in the 1980s were to do with Bedouin health, but also to do with the health of the population of the residents of Gaza. And we made several field trips to Gaza and indeed to the West Bank as well. This was before the first Intifada, which broke out in 1987. And at that point, there was free access. People could come and go. They could come from those territories into Israel, and people from Israel could go into those territories. There were no checkpoints. There were no barriers. There was nothing. There was complete freedom of movement. And sadly, all that changed after the second Intifada in the early 2000s. So I'm going to be, when I say Palestinian health, I'm going to be talking specifically about the residents of the West Bank and Gaza. I'm not talking about Israeli Arabs. And I'm not talking about the Palestinians living in neighboring Arab countries like Jordan, Lebanon, Syria, and so on. So I just want to make that clear. Jerusalem is sometimes, rather the eastern part of Jerusalem, is sometimes included in my data, sometimes not, depending on the data that I could get hold of. Now, this project all started because I was made aware, and a lot of colleagues were made aware, of an increasingly loud chorus of criticism directed from the medical press towards Israel. I don't know, is anybody here medical by any chance? Anybody in the medical profession? Okay, so I'll assume you don't know about this, but I know from talking to some of you informally that you may have heard about it. I've quoted here from The Lancet, the first quotation here, and The Lancet comes to play a very central part in our story this evening. This is what Rita Giacomin and her co-author said. Now, Rita Giacomin is a colleague of mine, a public health professor from Birzeit University in Ramallah on the West Bank. Highly respected, is often in the UK giving talks, receiving honorary doctorates, publishing papers in prestigious journals like The Lancet and the British Medical Journal. There's what Rita Giacomin says, and I've highlighted her quote because I want to contrast it with a quote from some years later, just to show you, actually, there isn't a contrast, it's much the same thing. So this is what the critics say. Between 67 and 93, health services for Palestinians in the occupied territory were neglected and starved of funds by Israel. That's a very strong accusation. Neglected and starved of funds. That implies a deliberate policy designed to do harm to the Palestinian healthcare system and to Palestinian health. So it's a strong accusation, and it's being published in one of the top 3 medical journals in the world. Okay, the top one is the New England Journal of Medicine. The Lancet comes second or third, depending on how these things are counted. So that's pretty strong, and I was aware that in 2009, the Lancet had established an organization or a network that they called the Lancet Palestinian Health Alliance, perfectly entitled to do that, which was going to be a platform for publications and lectures and meetings about Palestinian health. Also, I have no problem with that. But then when I read something in a journal that is supposed to be peer-reviewed, those of you who have an academic background will know that that's very important. A peer-reviewed journal means that before anything is published, it has to go through a number of hoops, whereby senior colleagues vet everything, literally every word and every number that appears in that article is vetted and commented upon and criticized by colleagues. And only after it's been through that peer-reviewed process is the article published. And I thought, that's very odd that this kind of thing is being said and the peer reviewers are not commenting on it or asking it to be toned down or removed. Because it did strike me that this was simply untrue, what was being said here. And there's another quote from The Spectator, not a medical journal, obviously, from Amy Shalan, who's one of the co-founders of Medical Aid for Palestinians that you may have heard of. And again, there it is, health services in the occupied territory were starved of funds. Very strong language. Shortages of staff, beds, medication, specialized services. Now, I was reading all of this stuff while I was doing my full-time academic work at Glasgow University. I didn't really have time to go into a detailed rebuttal of this. But once I retired a year or two ago, then I did have some time to work on it. And Alan Johnson, who's the editor of a journal called Fathom, some of you may know Fathom magazine. It's an offshoot of BICOM, a very good website worth looking at. He asked me to really address the Lancet's accusations in detail and provide a rebuttal if I felt that there was evidence to provide such a rebuttal. Just to give you a little bit of context, the editor of The Lancet for about the past 30 years is a man called Richard Horton, highly respected, except for one or two little aberrations in his career, like the publishing of a paper some years ago that you may remember, allegedly linking the MMR vaccine with childhood autism. And for many years, Horton refused to retract that article, but it has since been fully retracted. So that was a bit of a blemish in his reputation, but other than that, he's highly respected. Here he is talking about medical aid for Palestinians at a meeting that was held under the auspices of the Lancet Palestinian Health Alliance. What did Horton do? Not only has he published articles that thrust accusations at Israel, but he has actually magnified those allegations and thrown his own tuppence worth in through editorials and other means. So this was from an editorial about the occupied Palestinian territory. And here we have the same accusation, that the people of the Palestinian territory matter because they're continuing to experience, this is 2009, 4 years after Israel's complete pullout from Gaza, they're continuing to experience an occupation that has produced chronic de-development. That's not just that they have stagnated, but the opposite. They've been de-developed for many decades. So again, the implication that this is a deliberate policy, and if you hear some of the things that Horton has said in public, it's very clear he means that it's a deliberate policy. So, what did I try to do? I tried to answer this question, very simple question. Has Israel damaged Palestinian health? Now, some people, when they see that, burst out laughing. They can't think of anything more absurd. Well, obviously, Israel has damaged Palestinian health in so many ways, whether it's responding to rocket attacks in Gaza, through various conflicts, through the erection of the security barrier, through the stop and search and equivalent policies in Israel. Of course, they've damaged Palestinian health. And I have to say, my approach to this was that I probably would be in for rather an unpleasant shock as to the degree of damage that Israel has probably perpetrated, perhaps through no fault of her own, but if you occupy the territory of people who are hostile to you, there are going to be a lot of negative consequences. And my objectives were divided into these two parts, and I really want to concentrate on the second of those, but I'll cover the first one as well in passing. So that was my question. What was the impact of Israeli policies and practices on Palestinian health? Now, in epidemiology is the basic science of public health. What we try and do is we build up what we call a community diagnosis, a picture, a profile of the population. And we always start with demography, the basic statistical information about populations. So there you can see, I'm not going to go into this in detail, but the point is that between 1967 and around 2010, the Palestinian population more than trebled. More than trebled. Now bear in mind, this is during a time when Israel's detractors are telling her that she's practicing ethnic cleansing on a massive scale. So this so-called ethnic cleansing has resulted in a trebling of the Palestinian population, which incidentally is a bigger increase than happened to the Israeli population. But broadly speaking, Israel's population also trebled, and both of these, I think this is one of the interesting findings, both of these phenomena can be attributed to these three factors: a high birth rate, improving life expectancy, and net inward migration, something that's not appreciated, that much of the Palestinian population has been boosted by net inward migration from countries where Palestinians work. For example, in the Gulf, there are many Palestinians, and many of them actually were kicked out after the first Gulf War by the Kuwaitis at the end, because they took the wrong side against Saddam Hussein. And many of them came to the West Bank and Gaza. Now, an index that we pay a lot of attention to in public health is infant mortality. Without going into details about this, if you have to pick one index of health of a population, choose infant mortality, because it seems to be particularly sensitive to the general conditions prevailing in a society, the level of health care, the efficiency and effectiveness of government interventions. And that's why we choose infant mortality. In Western countries, it's not so helpful because it's so low. But in developing countries, we still use infant mortality. Now, this graph shows infant mortality over, roughly speaking, a 30-year period in the West Bank and Gaza. And it's very obvious what's happened. It's fallen. There's a little bit of a plateau in the middle, as you can see there, around about 98 to round about the mid-1990s, actually, there's a bit of a plateau. I don't have an explanation for that. The only observation I will make is that in the mid-1990s, responsibility for health, public health, was transferred from Israel to the Palestinian Authority. And it's thought that some of the programs that Israel started were discontinued, others were continued. But that's what happened. And if you look at the proportional decreases in infant mortality between the 1950s and 1980s, if you look at that far right-hand column, you'll see very substantial decreases both in Israel and in the West Bank and Gaza and in many of the surrounding countries. It was a regional effect, actually, probably of economic development. Israel started with a relatively low rate in the 1950s, but managed to continue the progress in bringing down infant mortality. Palestine started with, I've called it Palestine, West Bank and Gaza, started with a very high rate, mainly due to the neglect of health and health care by the Egyptians in Gaza and the Jordanians in the West Bank, respectively. And again, you can see there, as a result of a variety of factors, there was a decrease in infant mortality right up to the 1990s. Immunization coverage is another very good indicator of public health, because immunization is one of the most powerful tools at our disposal to improve the health of children in a population. And what we try to do with these vaccines that you see listed there, we try to get as close to 100% as we can. We can't get there. In this country, it's in the low 90s. Occasionally it drops into the 80s, such as after that MMR paper. But you can see here that the formatting has gone a bit ski-whiff, by the way, but the left-hand column are the Palestinian territories, and the right-hand column is Israel. And what you can actually see is that in a number of cases, the West Bank and Gaza did better in terms of their immunization rates than Israel did. And the rates are very comparable with other regional rates. If we look at education, now education is absolutely crucial to the health of a population, particularly female education. And from a very low starting point in 1970, remember Israel had been in control of these territories since 1967. In 1970, nearly half the population had no education at all. And over time, that proportion dropped. And if you look at the bottom line there, the proportion receiving 13 years or more of education increased more than tenfold. So you see the point, you see what's happening here. There's a pattern developing here of major improvements in health and what I've called the public health infrastructure. Water is a highly politicized issue. You've probably heard about Israel stealing water from the Palestinians. On the contrary, between the 1970s and the 1990s, a period before the Palestinian Authority took control, the proportion of homes with running water and electricity increased very strikingly. There are the figures there. They come from an Israeli bureau, but nobody has challenged them. The Palestinian Authority hasn't challenged them. And the increase in Gaza has been actually greater than in the West Bank. I'm not going to dwell on this slide, just to make the point that fairly sophisticated healthcare was introduced into the West Bank and Gaza for the very first time in the 60s, 70s, and 80s in all of these areas. And a very important point is that last bullet point, because it draws attention to the fact that Israel established training programs for healthcare professionals in conjunction with the 5 new universities that Israel had established. So, my conclusions. The central allegation was, you'll remember, that Israel systematically damaged Palestinian health and healthcare. Well, it's not only untrue, it's the opposite of the truth. Israel substantially improved Palestinian health from 1967. And that happened in the face of terrorism, war, and hostility coming from those territories throughout that period. And yet, despite the evidence I've presented to you, that I don't believe anybody can challenge, the data come from a variety of sources, including international sources such as the World Health Organization, the World Bank, and the Palestinian Health Service, as well as the Israeli sources. Despite that, Israel's critics, and I've put that in inverted commas because I want to come back to this issue of who these critics are, continue to blame Israel for what happened and what is happening today. They call it the legacy of occupation. Whereas, in fact, the legacy of occupation is rather positive. Okay, that's just an acknowledgement. You can read a more detailed account of that report in Fathom Journal. It was published about a year ago, and it's still online. So I'm going to pause there and ask if anybody's got any burning questions or points of information before we move on to the next topic.
Have you issued a rebuttal to any of these claims in 2009 research?
Yes, well, I'm going to explain in the next section what we did in relation to what the Lancet got up to after last year's war between Israel and Hamas and the Gaza casualties. And we wrote a very detailed rebuttal, which they didn't publish. But but at that point, at this point, in relation to 2009, all those of us who knew something about Israel and who cared about Israel could do was just observe with mounting dismay what was happening. Because it's actually very time-consuming to mount an evidence-based rebuttal of this kind. I thought it would take me a few weeks. It took 7, 8, 9 months to complete that report. Any other questions or comments?
First question that comes to mind is who funds the Palestinian Authority? How is the funding organized? Because Abbas is continually complaining about the lack of funding in one sphere or another. And he blames Israel, of course,
Yeah.
Israel is the center of the attack.
Yeah.
So who is responsible for the funding? And in what way can Israel avoid, it can't avoid lives, obviously, it has to live with how you realize that. How can that situation change? Because I presume at the end of the evening we want change in some
Sure. Well, much of his funding comes from us. Much of the funding comes from EU taxpayers. The EU is the biggest single donor to the Palestinian Authority. In addition to that, private individuals give donations to organizations that perhaps many people here support. And, you know, NGOs like Oxfam, Save the Children, who also provide healthcare facilities and other facilities on the West Bank and Gaza. And then the United Nations, which again we indirectly pay for, through an organization called UNRWA, the United Nations Works and Relief Association. They provide a lot of services specifically for the refugee populations. That's refugees and their descendants, which we may have time to talk about if the opportunity arises later. So it's complicated. And then, of course, Israel provides some funding. Israel continues to provide funding, but at a lower level, obviously, than she did. She provided the bulk of the funding when she was in direct control of these territories. But since the Oslo Accords, which created the Palestinian Authority, much of that funding ceased, and funding is raised from local Palestinian taxes by the Palestinian Authority and put into their infrastructure.
The article to me seems very contentious. Were there any letters refuting it in the Lancet?
Do you mean the critical article or my article?
No, not your article. The article there about damaging their health.
There were a couple of letters published, not very little, relatively little, but colleagues of mine from Israel did respond and did attempt a more detailed rebuttal. And I saw some of the drafts that they had submitted, but they were told, no, this is too long, and eventually, relatively short, one or two short letters were published. That was all. I'm going to move on because we'll get bogged down at this stage in the evening. If you don't mind, please save your comments or questions for later on, because I'm sure they'll crop up again. I'm going to move on now to the specific issue of Gaza. So we're now honing down now. We've started with the Palestinian territories generally. We're going to hone in on Gaza that you'll be very familiar with, and this is the kind of image that you'll be very familiar with. Tragically, that we saw last year for a period of a few weeks, totally unnecessarily, as it happens, if ceasefires that Israel had been accepted by Hamas as well. I wonder if it reminds you of any other images from the Middle East that this may remind you of. Well, it's almost interchangeable with the pictures we see from Syria that we've been seeing for, 4.5 years now? And yet, the degree of outrage provoked by those images from Syria is minuscule compared to the outrage that was generated by this conflict. And within a matter of 2 weeks of this conflict starting, the Lancet, here we are again, the pantomime villain, reappears on stage and publishes this open letter, so-called, to the people of Gaza. Some of you may have heard of this episode. And the people who published it include some very distinguished colleagues of mine. I mean, I know Syrian Chalmers personally, and I know many of the other signatories personally. Highly intelligent, extremely charming people. And I have to say to you, you don't need to read that fine text in detail. I've extracted some of the things. You can just glance through it as I'm speaking. There is barely a sentence in that extremely long letter. It's a 1,500-word letter. The maximum length of a letter that the Lancet permits ordinary people like you and me to publish is 250 words. This 1,500-word letter contains barely one line of truth. One line. All of this is complete nonsense. It's just not true. And the idea that Israel manufactured the crisis to masquerade a massacre, there's no mention of rocket attacks. There's no mention of any responsibility on the shoulders of Hamas for this conflict. And there's a lot of discussion about the siege that they call the partial military blockade and the hunger and thirst, and then there's this rather dark reference to targeted weaponry used indiscriminately and on children. And it gets even worse. I haven't put everything in that I could have done. But not only that, I mentioned the issue of peer review in medical journals. But the other thing you have to do if you submit either an article or a detailed letter of that kind, you have to declare your interests, such as I did this evening. At the beginning of this evening, I declared my background and my connections with Israel. All of these authors are associated in one way or another with extremely anti-Israeli groups. None of them declared any competing interests. It said competing interests, none. And the other thing was that shortly after the letter was published, it emerged that the lead authors, Paula Manduka and Sui Ang, had been circulating and endorsing blatantly anti-Semitic emails talking about the way talking about international Jewish control of the media and of the foreign policies of a number of key countries. And Mads Gilbert, that's the character on the second from the right there, a Norwegian pediatrician, actually defended the 9/11 attacks shortly after they happened. He's a man of extreme views. And there's a picture of Syrian Chalmers, my colleague, who set up something called the Cochrane Center. Now, the Cochrane Center has been highly successful. What it tries to do is it brings together evidence on what works and what doesn't in medical practice. He got his knighthood on the basis of that, and he's a big name in the medical world. I mean, it was his work that led to the establishment of NICE and other similar organizations that really are there in order to assess the evidence about the efficacy of treatments. And yet, here is a man puts his name to a letter that doesn't contain any truth in it whatsoever. There was a huge furore around this letter, and many of us wrote, and I wrote as well. I wrote a very detailed rebuttal, which they declined to publish. One or two Israeli authors did actually get published, but it was all too little and too late. And some very well-meaning people in Israel at the Rambam Hospital in Haifa decided, look, this man obviously doesn't know Israel. Let's invite him, and he can see for himself that what he's hearing about and what he's writing is simply at variance with the facts. So they invited him, and he went to Rambam, and this is him giving his talk. And in it he said that he deeply regrets, I'll quote you his exact words, I deeply regret the totally unnecessary polarization that letter has caused. Note his words. He doesn't regret publishing the letter, he regrets the response to the letter. And when a number of us wrote to the publisher, we were getting nowhere with Horton, so we wrote to the publisher, Elsevier, and when that word of that got out, a group of people got together called Hands Off the Lancet, and because they thought, the lobby were interfering with free speech. And as a result of that campaign, it got into the mainstream media. And one of the journalists, I think it was from The Guardian or The Independent, asked the former editor of the BMJ, Dr. Richard Smith, for his reaction. Now, I've met Richard Smith. I've on several occasions. Charming man, highly intelligent, well-informed. His verdict was, good on the Lancet, they are trying to speak truth to power. So again, there's this strange psychological phenomenon of not only accepting a certain degree of bias, but actually inverting the truth and believing that something that is blatantly false and indefensible based on the evidence is true. And the process continues. This is from a couple of months ago in The Independent, that headline. And they were quoting a paper about infant mortality in Gaza in recent years, incidentally, not during the period that Israel was there. And I looked at the original paper, and this is what the authors actually said in their discussion. These estimates are based on small numbers of deaths, and the confidence intervals are wide. The confidence intervals, it's a statistical term, which means that the true figure could lie anywhere between a higher level and a lower level. So the infant mortality rate could in fact be stable or continuing to decline. But that didn't matter. That didn't stop the media saying the infant mortality rates are shocking and Israel should be held accountable. Okay, what did happen in last year's conflict? Well, I'm sure most of you here will be very well aware of what actually happened. There were rockets being fired at Israeli civilian centers, and that Israel had to respond to those rocket attacks as any country would. And the major casualties, there were about 2,000 casualties, which Israel says were 50-50 combatants to civilians. The bulk of those casualties happened as a result of the ground offensive, which was launched, if you remember, after the discovery of the tunnels burrowing from Gaza into Israel. But even that wouldn't have happened had Hamas accepted an Egyptian brokered ceasefire, and eventually the terms of that ceasefire became the terms of the final ceasefire. All of those casualties, or most of them, could have been avoided. And then you've probably also heard, I don't think I need to tell this audience about the measures that Israel took to try to minimize civilian casualties. And I've highlighted in bold there the fact that no army in the world goes to such lengths. No other army in the world, including our own. And let's wait and see what happens, because we know that we are likely to be involved in some military action in the very near future. Let's see to the extent to which these measures are so extensively implemented compared to what Israel did.